People don't seem to view behavioral health in the same way anymore. In fact, we've seen a once prevalent stigma against mental health, trauma-induced PTSD, and substance use disorders slowly but reliably erode over the years. The shift in attitude has proven invaluable towards shaping a social climate that not only makes it easier for people to seek help during an emergency, it's championing a world where maintaining good behavioral health is beneficial for everyone.
The notion of behavioral health is really all-encompassing. On a technical front, it means mental health and psychiatric disorders and substance use. But I think the most pragmatic way to think about it is to consider a person's biological, psychological, social, emotional, spiritual needs all woven into one.
Behavioral health is a significant part of wellness. I think about an individual's experience of quality of life, and I think about their overall ability to function. And so one's mental wellness is going to have perhaps as much an impact on an individual's quality of life, an individual's ability to function in their life, perhaps more so than just about any other condition I can think of.
It's really important for everyone to consider the notion of behavioral health. It's not just a moment in time because there's a crisis. It could be around preventative measures to keep yourself healthy. And sometimes it literally means turning off the TV, silencing your notifications, because goodness knows there's so much happening in the world that can erode our ability to feel healthy. So I think it really is something that's dynamic.
You know how you feel when you are doing your best, what kind of interactions you have, how much joy you're finding in your day-to-day activities. If you have that awareness, then you should also have the awareness of how you're feeling when you're not well. Are you sleeping? Are you eating? Are you getting into arguments? We all have experienced some kind of behavioral health crisis. It could be due to a mental health condition, or it could be due to a loss. You might be grieving. And so if you are finding that you are struggling, it's important to seek support.
For society as a whole, the sickest among us are folks who actually are family members, are community members. COVID-19 showed us that a person being sick on the other side of the world can impact us. So we know that folks in our community need help, and that'll help all of us.
If you can think, what would I do if I were having distress? When you're in a good space, it makes it much easier to know who to call, when to call, and to have your care team around you. Alameda County truly is a rich, diverse place. And in that, there are rich opportunities for education and the arts. It's the Bay Area, it's cutting edge, and it's complicated, where we have many individuals who have wealth and others who are struggling. Alameda County Behavioral Health have physicians, we have psychologists, we have nurses, nurse practitioners, pharmacists. We have clinicians, case managers, social workers to provide support, to outreach, to connect with you, whether it's crisis services, wherever you're at. We don't check insurance cards, so if you called us, we would just come out there and help and support you and connect you either to your private insurance, or if you have none, to us or any other county resource. And so we're an incredibly large organization that mostly sits behind the scenes.
When you're in the community looking for resources, a typical medical or mental health kind of setting just can be very intimidating, whether it's their first attempt at seeking services or their 10th or 100th time. So providing services in the communities where people are seeking them is an essential way of engaging people. You know where the building is, you know who works there, you know what the parking lot looks like. And so even on your worst days, having places for people to show up, but also have people to show up is essential to meeting the needs of those we serve.
Adapting to what's happening real time and listening to what folks have to say, along with the best practices, marrying that together is the best way that we can design things moving forward. People want their services delivered in different ways. QR codes, working with technology, making sure that folks get what they need, when they need it, and in the ways that they deserve to be served.
In Alameda County, we are very fortunate that we had the forethought to develop a mobile crisis team way back in 1988. We realized that there were people who couldn't seek help on their own. So we go to where people are. For some individuals, it's the first time they've ever had contact from a mental health provider. We can do everything from a welfare check to crisis intervention.
The other change that we're making is making sure that mental health and addiction are better integrated. And so if someone goes into a mental health setting, we're doing a lot of training and other structural changes to make sure that there's addiction awareness. This is an exciting time to be involved in addiction care. I think historically there's been a sense that addiction was something that people couldn't overcome, that it was a hopeless situation. And that's really changed a lot. There's a lot of effective treatment now and a lot of different approaches and choices for people so that they can find their own way in recovery. It's also deeply meaningful that there's this group of people who continue to be seriously stigmatized, people who use drugs, people with addictions, and create a system that treats them like human beings. Because we are all in this together, and that feeds the work that we do.
I'm Mary Hogden. I work for Alameda County Behavioral Health. I am somebody that has lived experience. I have a very, very colorful past. I was once a recipient of services from Alameda County Behavioral Health. I was able to get housing through this organization, through Alameda County. I was able to get substance use support. I was able to get mental health therapy. There's a lot of shame. I was so ashamed of myself when I first got into these programs. Now I wear it as a badge of honor. I'm not ashamed anymore. It's all about recovery, hope. We've got people now that have come through that never had a job, that now are working and that are successful. It happened for me. It's magical. It's magical.
Alameda County Behavioral Health Department. We are here to help. For more information, visit acbhcs.org.